Hello, I'm Dr. Michael Sullivan, facial plastic surgeon at the Sullivan Center for Plastic and Cosmetic Surgery in Columbus, Ohio, and I specialize in rhinoplasty surgery. Today I wanted to talk a little bit about a question that I'm commonly asked is, how do I know if I've broken my nose, or what do I do if I've broken my nose? First of all, don't panic. If you have some bleeding as a result of a nasal injury, that's usually an indication that you've broken your nose. Or if your nose looks different, it's deviated as a result of that injury, more than likely it has been broken. Again, don't panic. Control the bleeding by pinching your nose and relaxing. You can take Tylenol or extra strength Tylenol for comfort, but avoid any aspirin, Advil, Aleve, Motrin, any of the non-steroidal anti-inflammatories, because that can increase bleeding. The diagnosis of a nasal fracture or a broken nose is actually a clinical one. Oftentimes patients will go to the emergency room and have an x-ray, which in my estimation is useless. A doctor who's knowledgeable about nasal injuries or rhinoplasty would be able to make that diagnosis by palpating the nose. If the nasal bones have been disrupted, then there's two ways to handle that. First, it can be done immediately by doing what's called a close reduction, where that nasal bone is pushed back into place. That can be done under either a local anesthesia or a general anesthesia. It's a short procedure, and oftentimes, I would say probably 75 to 80% of the time, that can take care of the fracture. If that doesn't, or if the fracture is older, then the required procedure would be a rhinoplasty, is going in and resetting those bones, repositioning those bones, and correcting any other deformity that's resulted as a result of that injury. If you have any further questions regarding nasal fracture, nasal injuries, or rhinoplasty, please don't hesitate to call me at the Sullivan Center, 614-436-8888, or visit my website at www.sullivancenter.com.